Okay, go ahead.
All right. Well, welcome to our group. We're the group of What is Osteopathic Medicine? And we have Katie Kleinman, Susan Merritt, Dane Mitchell, Shani Mobley, Mariah Southwick, and Susanna Whitaker. So I'm going to begin. And how does osteopathic training differ from traditional medical school training? Good question. A DO, which is an osteopathic doctor, is licensed to practice in the United States. They have to have a requirement of a bachelor's degree, 4 years medical science education, 2 years of classroom training, 2 years of clinical training, and 2 years of additional mandatory training in OMT, which is osteopathic doctors will normally spend more time learning and developing hands-on, making appropriate physical contact, and DOs are generally taught to touch patients and have a more holistic approach. So that is part of their OMT training. Their primary focus is healing the patient through interpersonal skills and physical contact, like I just said, and seeing the patient as an individual. Drug therapy may be used as well as osteopathic manipulative treatment. The 200 hours of additional training in osteopathic manipulative medicine teaches them the practice of manipulating musculoskeletal tissue to relieve pain, where an MD would suggest pain medication. An MD is also, which is a medicinae doctor, is another physician licensed to practice in the United States. Their educational requirements is a bachelor's degree, 4 years medical science education, 2 years of classroom training, 2 years of clinical training, and if they want to continue, they can go into specialty training or even subspecialty training. And their primary focus is getting rid of disease through the use of drug therapy. So the main thing is that both doctors are similarly educated and trained, but there are differences in their training and philosophy of patient care.
So why is there a second medical degree separate from an MD? The osteopathic philosophy involves treating the mind, the body, and the spirit. It's a more holistic approach for the patient. The osteopathic approach is less about prescribing medications and medical procedures and more on the body trying to heal itself. In today's world of increasing popularity of preventative medicine, a second medical degree or a doctor of osteopathy is quite necessary. A DO receives mostly the same training that an MD receives, as we talked about in the previous slide. They complete the 4 years of schooling and then a residency program in their chosen field. The major aspect that sets a DO apart is their additional training in OMT, whereas an MD focuses more on the treatment of pain or injury. A DO focuses on the body's capability of healing itself and the prevention of illness through physical manipulation of the body. This plays an important part in the philosophy of public health. Many DOs choose to work in fields where preventative medicine is key. Osteopathic physicians are more likely to view a patient as a whole person, taking into account not just the physical symptoms, but also lifestyle, emotional well-being, and environment. In our society today, where drugs and surgery are pushed as the only solutions for illness, this is vital. In patients and physicians, MD and DO, manual therapies such as OMT have had an increasingly positive reputation in their ability to heal. A survey published in the Journal of Continuing Medical Education showed that 81% of physicians and 76% of patients felt that manual manipulation was safe. Over half of physicians and patients felt this type of treatment should be available in our primary care settings. Having another option for medical care instead of a traditional allopathic doctor could even decrease the cost of medical care. One Florida hospital found that total costs for migraine patients were 50% less when OMT was included in their treatment plan, mainly due to the lower rate of drugs prescribed. Providing a second medical degree, such as a DO would, with other treatment options, presents the effective treatment with a lower overall cost.
When and where was the first osteopathic medicine program or medical program launched? Dr. Andrew Taylor Still opened the first medical program in 1892 in Kirksville, Missouri. Dr. Still, or the A.T. Still University Kirksville College of Osteopathic Medicine, remains the oldest of the osteopathic medical schools.
Okay, moving on to the osteopathic physician interview. I wanted to introduce you guys to Dr. Todd Capistrant. I first met him when I was teaching his daughter's ballet, and I later became a patient of his. He was able to help me with some really bad headaches that I had, and I'd been going to various MDs for years, and they tried everything from injections to medications to I can't even think what right now, but Dr. Capistrant was able to get me fixed up in a couple of treatments, and so that's when I was sold on osteopathic medicine for myself. But Dr. Capistrant is a DO. He's also has a master's in healthcare administration. He's the co-founder of the FDM Academy and president of the AFDMA, which is the American FDM Association. And he's the director of OMM at Tanana Valley Clinic in Fairbanks, Alaska. And how he got into osteopathic medicine was his father was an MD and wanted his son to follow in his footsteps and become a doctor, but originally he wasn't at all interested in becoming an MD. But his dad knew that he really liked to use his hands, and he encouraged him to take the path to becoming a DO. And Dr. Capistrant feels that there are more similarities and differences between DOs and MDs. He says they take most of the same courses in medical school, they use the same textbooks, they often work side by side in the residencies. But one important difference he feels is that DOs tend to be more hands-on, they're more comfortable with touching their patients, and he feels that's in large part due to the fact that many of them use spinal manipulations and other hands-on treatments. He also feels that they tend to view the body as a whole rather than compartmentalizing it as many MDs tend to. And when he was applying to different programs, he noticed a big difference, he said, in the clientele or the students that the MD schools attracted tended to be very high academic achievers, but didn't always have the same interpersonal skills that the DO programs did. And he said that the MD programs, he often felt that the other students viewed each other as competition, and at the DO schools they tended to view them more as sort of friends on the path to becoming physicians together. And he said that the DO schools also tended to attract people with more life experience, and the MD schools tended to attract just the highest academic achievers. And he feels that's one of the reasons that many DOs have better interpersonal skills, better bedside manner with their patients. And that leads into the next topic of are there feelings of competition between MDs and osteopaths? And he feels that sometimes there are. He says that 30 years ago, the quality of DO programs wasn't as consistent with that of the MD programs. So some of the older MDs may still see the training of DOs coming through as inferior to theirs. And if the MDs are in any way involved in teaching patients, they may pass that bias on to their students. But Dr. Capistrant also says that he personally knows many resident directors that prefer DO students because they have the same academic qualifications and tend to have a better bedside manner.
All right, locations of osteopathic medical schools. There are 33 accredited osteopathic medical schools with 48 different locations in the U.S. I've listed all the states that are in there below. And because there's not a lot to talk about this subject, I looked, and for 2016, the #1 school for osteopathic medical school was the Oklahoma State University Center in Tulsa, and it is ranked at the top because it is, as far as tuition, it is not as bad. I mean, it's medical school, and so residential tuition is about $22,000, and also their average MCAT is 27, and their average GPA is 3.6, and that's why it's partly the #1 school as of this past year.
Sorry, I started talking and realized my speaker wasn't on. The principal figure in the development of osteopathic medicine was Dr. Andrew Taylor Still, and he was he's the son of a Methodist minister who was also a physician, and at an early age he decided that he wanted to follow his father's footsteps and become a physician. And he served in the Union Army during the Civil War, and after the Civil War he suffered the deaths of 3 of his children from spinal meningitis in 1894, and after that Dr. Still concluded that the typical practices or the orthodox practices during that day were often ineffective and often harmful to those that were having the treatments. And so he then devoted the next 10 years of his life to studying the human body and finding better ways to treat diseases. He believed that if you treated the whole body rather than just the diseases, so he wanted to treat the body structure, etc., you could gain better health for your patients.
Okay, so Abraham Flexner, I wanted to talk a little bit about kind of his early life, and then I'll talk a little bit more about his report. He was born in Louisville, Kentucky to a Jewish family, and he had the opportunity to be educated at Johns Hopkins University, where he studied Greek and Latin. And then later he had the opportunity to go to Harvard to finish his schooling. And after he graduated Harvard, he went to Europe and he studied the educational system, specifically of American medical students that had gone to Europe to study. And he became very interested in some of the systems that they used in Europe, specifically in Germany. And then upon his return, he published a book called The American College. And in this book, he kind of critiqued some of the general practices of higher education medical programs in the United States. And after he wrote this book, there was a man named Henry Pritchett who was the head of the Carnegie Foundation. And this foundation was focused principally in this time on improving higher education in the United States. So because of this, Abraham Flexner was offered the task of surveying a bunch of all the US schools and Canadian schools for their medical programs. And he was commissioned to use Johns Hopkins as kind of the gold standard and compare the other schools to Johns Hopkins. So he embarked on a tour where he, for a couple of years, went and he surveyed all these different schools, and he divided them up into 3 tiers. The tier 1 are schools that already compared favorably with Hopkins, the ones that were already kind of the gold standard. Tier 2 were schools that were considered substandard, but that could be fixed with additional funding. And then he ranked tier 3 schools as ones that were completely substandard that he didn't think could be fixed by funding. And actually 1/3 of American medical schools and programs fell into this 3rd category, and many of them were closed. So there's a couple different results of Flexner's report. In addition to kind of changing the way that we educate to reflect more of the European style, specifically the German style, he kind of changed the way that doctors behave as far as patient care versus research. And he found that in Europe, a lot of the doctors were more focused on research rather than just focusing on patient care, whereas here in the United States, doctors focus principally on patient care and less on research. As a result of his report, a lot of the system of the American medical practice actually changed too. And so doctors began less focusing on patient care and more focusing on new scientific discoveries. And as a result of this, a lot of the medical discoveries were actually right here in America. So it did kind of change the way that, people viewed doctors, as opposed to seeing them as, healers that really are intimate and close with them. They view them more as cold scientists. And we've kind of had to change that with DOs, for example, and we've had to kind of bounce back from that so that we can build a relationship of trust with our patients once again. And then these are the references that we used.
Awesome. Great work. You guys covered the topic really well. So I typically ask everybody the same question at the end. I'll let Susanna kind of be exempt from this question since she can't hear me. But we'll start with you, Cheney. Just a quick question is, what was the most interesting thing that you learned as you were studying this topic?
Truthfully, it wasn't anything from my slides. It was from the Flexner's report. Oh gosh, what was it? I have to look at the slides again. The three different, where was it? The three different, oh my gosh, what are they called? Tiers, there we go. Just that so many of the schools were closed down because of his report. That shocked me a little bit. I had no idea that had happened. So
definitely, yeah, that was an interesting thing too when I learned that, for sure. All right, Dane.
Can you hear me?
Yeah.
Okay. I just thought it was interesting that when he went, I also, I kind of agree with Cheney that just his report had such an impact, not only on the educational system in the United States, but also on how, the doctor-patient relationship works. And I thought it was interesting just reading about how, and I didn't really include this as much in the report that we made, but he was really fascinated with the German system of medicine and kind of how they educated their physicians. And he realized that it was a much better system, and that's what he based a lot of his standards on was, the German system and how they did it.
Great. Awesome. Katie.
I really thought Abraham or Flexner's report was interesting, just on the history of how the American doctor is perceived among the public. I personally know many people who dislike going to see the doctor because they do feel that they're cold and not at all personable, when really when you're seeing someone for your health, you want to have a good relationship with them. And I don't know, being able to visit a DO just kind of opens up a whole other field of health practitioner that could potentially change that viewpoint.
Awesome. Definitely. All right, Mariah. You're on mute.
There we go. I think with just studying this topic overall, like I haven't heard that much about it. I know a lot about MD and naturopathic, and this is kind of like a mix of that, and just more physical with the patient, which I prefer just because it's more like the doctor is actually caring for the person instead of just writing a prescription and here you go, have a good day. But I love the history of how DOs have come about and that how they're perceived still today, and that it seems like it's a growing field that a lot of people should look into, and it's definitely opened my eyes to more of what's in the medical field.
Awesome. All right, Susan.
Can you guys hear me?
Yep.
All right. Well, I really, really enjoyed this topic. Before this presentation, I had never heard of an osteopathic doctor. So I was very pleased to know that there were other types of healthcare or other types of caring for patients. And I am not surprised to see that the ODs are getting a good reputation because, as I've noticed, society changing, more people are wanting to go the natural way, the holistic way. They're wanting organic food. They're wanting to care for their bodies. And I think that in the past, a lot of people have been so used to taking pills and medicine that I am very pleased to see that there's a change going on in the medical world. So I was very happy to learn about that. In fact, I'm thinking of looking for an OD for myself now because I really, really liked what they stand for and what they learn and how they take care of patients.
Awesome. All right. Well, great work, you guys. You did a really good job. You covered the topics really well. I'll go ahead and stop recording, but hang on the line.